Prime Minister yesterday spoke about older people and the need for potentially people to visit in some cases. Can I ask you, in the home setting, how that operates? Is it okay for people to visit their grandparents, for example, and what would you suggest would be the best way for people to social distance or to conduct that meeting outside, or do you have any advice?
So I think the Prime Minister has acted on the advice of the Australian Health Protection Committee and announcements that's been made in the last few days reflect that. Firstly, that important component that we're not relaxing any of the measures at the national level that have been announced up to now for a period of 4 weeks. And so, as a colleague said to me today, just because you're slowing down, you don't take the parachute off when you're approaching the landing. You wait until you've landed. And so we are really very clear, and the Prime Minister is clear about this, that we're waiting for that 4 weeks to happen before we change our advice broadly about social distancing and the other measures that have been put into place. So to answer your specific question, we have always been at the the national level from the Australian Health Protection Committee. We've always had the opinion that whilst it's important to protect our vulnerable people in aged care facilities, that does not mean completely locking down at this stage. It's certainly taking every possible way that one can do this to decrease the exposure to people who may have the disease, and so there are a range of things there. So the statement from yesterday was really reinforcing that position to aged care facilities to think about what they have in place in terms of visits. To relate that back to a specific case of should grandchildren go to see their grandparents, I think that is a different situation, and to an aged care facility, people should make those decisions themselves. But in general terms, we're still saying just hold off for a little bit longer to protect those vulnerable people in their own home, and so think about the digital connections. Other connections that don't entail very close contact for the time being. Let's see how we are in a couple of weeks' time or 3 weeks' time, and then there will be announcements about relaxing some of these measures and our advice.
Professor, in terms of rural and regional Australia, could those areas be test cases for easing the restrictions?
So the rural and regional areas is a complex one, really. On the one side, we know that so far Australia has had a relatively small number of cases compared with many other parts of the world, and they have mainly still been associated with international travellers or people coming back from overseas. So the majority of those people up to now have been in our major cities. So our rural and regional areas, and particularly remote Australia, has been relatively protected. So for them to take on this burden of social distancing measures and the business restrictions that has entailed could be seen as being not proportionate to their risk. On the other hand, we do know that remote areas, regional areas and rural areas of Australia have less capability to cope with a large outbreak in terms of health facilities, for example, or even public health facilities to investigate such outbreaks. So I think it's reasonable, again, for us to wait a bit longer to really protect those healthcare assets in those places and to protect the communities in our rural, remote and regional areas.